Hello, my name is Ellie Eisenberg. I'm a family nurse practitioner student, and I'm going to be doing your annual assessment today. I'm washing my hands. Do I have your permission to post this to YouTube for educational purposes?
Yes.
Okay. So, what brings you in today?
Here for my annual checkup.
Okay. So, last time you were here, I'm just going to run through what we went over. So you were a little bit, you're a 26-year-old male, you're a little bit on the higher side for your BMI, and you were a pre-diabetic. So we went over education on how to limit your carbohydrates and how to start exercising some more. So how has that gone?
It's gone pretty well. I have lost about 3 pounds, and I've been playing soccer once per week.
Okay, that's good. You are moving in the right direction. We are going to get your A1C here today, and we'll look at that again. That might be back at the end of this visit. We can also touch on some more tactics to help you move forward in the same direction you're going in now. So we're also going to check your cholesterol levels today because it's recommended for your age group. And you are on no medications and you have no allergies. Is this correct?
Yes.
Okay, and we don't have any past medical or past surgical history on your chart. Is this true? You have no surgery history?
Yes, that's true.
Okay, and any family history you would like to add?
My mom has diabetes and my dad has hypertension.
Okay, that is very important to note. Thank you. Do you know when your last tetanus shot was? They're recommended every 10 years. So.
No, I think I was about 15 years old.
Okay.
Am I able to get that today?
Yeah, we can get you the TD booster today. That will cover tetanus and diphtheria. And then you'll be all set until you're 36, okay?
Great.
I'm going to start your physical assessment and ask you questions as I go. Just let me know if you're uncomfortable or anything.
Okay.
So you appear to be a well-nourished, well-dressed young man. Your vital signs taken today by my nurse were stable at 120/75. Your heart rate was 83. Respiratory rate was 14. You were at 98% oxygen on room air, and you had a temperature of 97.6, which is afebrile. This is all stable. Do you have any complaints that you want to bring up to me today?
No, I feel great. Just excited to start my new job as a PA.
Great. That is very exciting. So have you had any headaches, any dizziness, any double vision, blurred vision?
No.
No changes with that? Okay. Any ear pain, throat pain?
No.
No? Okay. I'm going to go ahead and look in your ears. Okay, your tympanic membrane is pearly gray, and you actually have no wax that I can see. Okay, good. If you could say ah for me, I'm just going to look back. Your tonsils are about 1 grade, so they're just coming out of your orifices. And stick your tongue out for me. Good. And I'm going to go ahead while I'm here and use my otoscope to look at your eyes. Okay, looks good. So your eyes are equal, round, reactive. Go ahead and shrug your shoulders for me. Good. Okay. So moving down, I'm just going to go ahead and feel your thyroid. So go ahead and swallow for me. Okay, I don't feel any asymmetry or any nodules there. I'm just going to take a listen to you. Have you had any chest pain, palpitations?
No.
I'm going to start right here, actually. So I can hear your S1, S2, your rate and rhythm sounds regular. Just listening for murmurs now. And I don't hear any. Go ahead and hold your breath for me. Breathe. Go ahead and hold your breath. And no breathe. I'm going to go ahead and start listening to your lungs. Okay, no shortness of breath. You've noticed any wheezing, cough?
No.
Okay, take a deep breath for me. Okay, if you can turn around and face that way just a little bit for me. See too. I'm starting way up high. And I would be doing this on your skin too, but you have to show that. So your lungs sound clear bilaterally. No crackles, bronchi. Okay. I'm actually going to have you lay down now. And I'm just going to first start by looking at your abdomen. Have you had any diarrhea, constipation, nausea, heartburn, bloody stool, tarry stool?
No.
Okay, I'm going to go ahead and listen. So I don't see any pulsatile masses. I don't see any asymmetry. I'm also checking the skin as we go through. Have you had any new moles or anything?
Nope.
You're wearing sunblock?
Mm-hmm.
Any rashes?
Nope.
I'm going to go ahead and listen to your aorta. So you have normal active bowel sounds. I don't hear a bruit at your aorta, and I'm going to go ahead and press on you. Let me know if it hurts at all, okay? So no distension or tenderness. I'm going to go a little bit deeper. Okay, so your abdomen looks good. While we're here, I'm just going to look at your range of motion of your knees. Do you have any pain with this?
Nope.
Okay, on this side. Any pain? Any joint pain you've had recently?
No.
Okay, you can go ahead and sit up. Okay, I'm going to feel for your DP pulses, which are 2+ on both, and your cap refill is less than 2 seconds. And I'm looking for any edema, and both your legs have no edema. If you want to press up on my hand, good strength. Press up, good strength is 5 out of 5, and push your arms out for me and press up. Good. And squeeze my fingers. Good. We always like to ask about psych. So are you feeling any sense of hopelessness or like you're not enjoying activities that you used to?
No.
No, you feel like you're still participating in all your hobbies?
Yes.
Okay. And have you had any numbness, tingling, falls, anything? Nope. Okay. So I think that you look good. And my nurse just got back to me and said your A1C was 5.9, so that's actually the same that it was before, and you are still in the pre-diabetic range. Okay. So although you lost 3 pounds and you felt like you're doing good on your diet, I want you to increase your exercise to 150 minutes per week. So if you could play soccer 3 times a week and add in another day, that's really what the American Heart Association recommends is 150 minutes per week. And they mean exercise to the point where you're out of breath and you can't hold a conversation. And in terms of diet, I would try to limit your carbohydrates. So that's bread, cereal, pasta, pastries, cookies. Okay. And then I'm going to send you a letter or give you a call on your cholesterol. So sometimes the triglycerides might be up because of your sugar intake. And so that will give us a little bit more of an idea too. Are you eating red meat?
You're not from time to time.
Okay, you're not a vegetarian, vegan?
No.
Okay, because then we would look into some other... and we're going to give you the tetanus shot.
Okay.
And do you know how to do, you said you're graduating PA school, do you know how to do the testicular exam?
Mm-hmm.
Okay, so they recommend doing that once a month too.
Okay.
I think that is everything, so I will give you a call with your cholesterol.
Sounds good.
Sounds good. It was nice to see you.
Nice to see you.
Okay.